Bismillah Rahman Rahim. Alhamdulillahi Rabbil Alameen. Wassalatu wassalamu ala ashrafi anbiya'i wal mursaleen. Sayyidina Muhammadin wa ala alihi wa sahbihi ajma'in. Assalamu alaikum wa rahmatullahi wa barakatuhu. Alhamdulillah, it's a blessing to gather here today as part of the UK Tamil Muslims family. As we welcome Ramadan, we also celebrate another remarkable year of growth, service, and unity across our community, beautifully captured in our 2025 UKTM newsletter. Over the past year, UKTM has continued to strengthen the bonds of brotherhood and sisterhood through inspiring initiatives. From our social meet in Aylesbury that brought families together in learning and laughter to our brothers' meet and men's retreat in Wales, every gathering has deepened our sense of togetherness and purpose. Our 5 UKTM chapters have also been very active. The career and education team guided members on UK immigration and entrepreneurship. The Marriage and Aspiration chapter hosted the successful Deen Matches 2025, helping many young Muslims find their partners. Under Health and Medical, we delivered life-changing webinars on cancer awareness and Ramadan preparations. Our Children's Empowerment team nurtured young hearts through the Hifz and Spiritual Weekend, while the Sisters Niha initiative empowered women with sessions on emotional balance, inheritance, and zakah. Across the UK, in Aberdeen, Croydon, East London, Scotland, and Birmingham, our chapters have been thriving, with Birmingham even purchasing our new Masjidul Rahman, alhamdulillah. Beyond our borders, UKTM has planted hundreds of trees in Chennai, raised funds for Gaza, and supported student education here in the UK, reminding us that our faith derives compassion and action wherever we are. As we look ahead in 2026, we pray for continued unity, service, and barakah in all that we do. May Allah subhanahu wa ta'ala accept our efforts and make UKTM a source of light and inspiration for generations to come. Jazakallahu khairan. And I am Shireen Ajmal, the Vice Chairman of UK Tamil Muslims. And now, without further ado, I hand over the stage to Dr. Ajumal, who will be hosting this session today, inshallah. Please.
Assalamu alaikum warahmatullahi wabarakatuh. I'm Dr. Ajumal, a senior GP in Lincolnshire. On behalf of UK Tamil Muslims, I warmly welcome you all to today's health expert question and answer session titled Ramadan for Everyone, Navigating Fasting with Medical Conditions. Thank you for taking the time to join us this afternoon. As Ramadan approaches, many of us are asking important questions. Can I fast safely? How do I manage my medications? When should I stop fasting? These are not just religious questions, they are medical, ethical, and deeply personal decisions. As you know, Islam places a very high value on preservation of health, and our faith gives clear concessions where fasting may cause harm. However, understanding when fasting is safe, when it needs adjustment, and when it should be avoided requires sound medical guidance. And that is exactly why today's session is so important. We are privileged to have an excellent panel with us, consisting of specialists and experienced clinicians. This session is designed to be practical, evidence-based, and reassuring. Our aim is not to encourage or discourage fasting, but to help you make informed, safe, and confident decisions for yourself or your loved ones. I would also encourage you to remember that if fasting poses a genuine risk to your health, breaking the fast is not a failure. It is an act of responsibility and is fully supported both medically and religiously. Please post your questions in the chat box or raise your hands and we will address it. There are no silly questions. If your question is relevant to you, it is likely relevant to many other listenings today. Once again, thank you for joining us. May this session be beneficial and may Allah grant us good health and the ability to worship Him in the best possible way. First, I would like to invite my colleague GP. He will introduce himself and then he will briefly tell about what is available in the public and then we can take it from there. I hand over to Brother Usman Shah.
Assalamu alaikum, everyone. So, as Dr. I'm a GP in Scotland, work in Lanarkshire and Glasgow. I've been doing it for the last 17 years as a GP. So, as Dr. Ajumal mentioned, the main aim of this meeting is to, or the question answer session is mainly to empower you with all the information and resources so that you can make some informed decision about fasting. So most of the information and resources, both for the healthcare professionals and the community for patients, are on in the British Islamic Medical Association website. I'll shortly share the screen soon, but all the informations are available in the British Islamic Medical Association website. I'll be probably using more of BIMA as a short acronym quite a lot for them. So BIMA basically has produced a Ramadan compendium, which is basically a very detailed, informative guidance on most of the health conditions with consensus from the generalists, specialists, ulamas, and Islamic scholars. But make sure you speak to your healthcare professionals to assess your individual risk and help you plan safely. Do not make a decision about fasting or not just based on this guidance. Also, I just want to point out that most of the healthcare professionals, may be the GPs, nurses, specialists, both Muslims and non-Muslims, may not be aware of that this guidance exists, and make sure you let them know about it so they can also look up for guidance if needed. BIMA, which is the British Islamic Medical Association, they have co-produced patient resources with various organizations, Diabetes UK, British Heart Foundation, Asthma Lung UK, and the Blood Cancer UK. So I'll shortly share the screen for you so I can see that. So that is, I hope everyone can see the website. That's the British Islamic Medical Association website. Yeah, okay. So you got that Get Advice on the British Islamic Association website. And if you can go there, there is the Ramadan compendium, which gives you a very detailed. I'll just show you this as well. So they have all the conditions, most of the health conditions, they're covering about cardiovascular, respiratory, chronic kidney disease, diabetes mellitus, adrenal, pregnancy, neurological. So all the medical conditions are all listed here with the detailed guidance. So I'm just going to share the Diabetes UK website. So basically, if you go to the BIMA website, you can click on to all the links are there. But Diabetes UK website, you see there is a separate article on diabetes and Ramadan, which gives you a detailed information, who can fast, who cannot fast, about guidance on when to test your blood sugars, when to stop fasting, when to break your fast, and also risks of low sugars, what is best foods to eat for your suhoor and for the iftar. So there's lots of information on the Diabetes UK website about Ramadan and fasting. Again, there's a one-page information that's available even for imams as well. And I'm just going to go to the next one, that is the British Heart Foundation, and they have a very detailed information as well about how to have a heart healthy Ramadan when you are fasting. So they've given you details about what you should eat and drink, and also whether you can change the time you take your medicines when you're fasting, and there's all information there. But also specifically to the heart condition, when you should seek medical attention, like if you're having breathlessness, fluid building, lots of informations are there on the British Heart Foundation website. Other thing is, the next one is the Asthma Lung UK website that also has lots of information about fasting with lung condition. So they have everything, whether if you have asthma, chronic bronchitis, emphysema, bronchiectasis, pulmonary fibrosis. So all the lung conditions, they've given the information. And more importantly, they've given you a very detailed about lung medications that could break your fast, and which medications you can take, which will not break your fast. They've given a very detailed information. And again, same as other websites, about what you should eat during Ramadan. So lots of information there. And fasting with adrenal insufficiency and endocrine, that's also available in the BIMA website. And again, there's a Ramadan and kidney health condition as well. So they basically are very good information about who there's a low, they stratify the risk about low risk, high risk, very high risk. So there's information for people with kidney disease as well. And there are advice on using the drops for glaucoma, people with glaucoma, to use the drops, and how to use your drops. So all the informations are there, type of thing. Okay. I'm just going to search it. So as I said, the fasting is a very personal and individual decision, but there are information available for you to make those decisions. Thank you.
Jaskar Hairan, Brother Jeeyavudeen. I think so. I think a lot of people will be asking, because UK Tamil the most important is, we just wanted to, he had briefed about all the resources which is available on the internet, which all of you can use it, but it'll be very specific if you're going to ask any specific questions. So we had actually asked our members whether they have any specific questions and queries, and we have themed the questions because we have got various specialists here. We've got a diabetologist, nephrologist, we've got a cardiologist. So we thought we'll just ask few questions and then we'll take it from there. Thank you, Dr. Usman. That was very, very useful. I think so it'll be very beneficial to all the people. And I think so the best is for the people to take it and discuss it with their GPs if they have any questions or queries. And I'm sure the UKTM also, there is a facility where you ask the expert. So they can use that as well to ask us what it is. Okay. So we have received various questions. So because we have the endocrinologist, he will introduce himself in last. Let me go on with the first question. Just common questions. I think so it'll be useful for others as well. How do I recognize low or high blood sugar while fasting? Brother Jeeyavudeen, if you can introduce yourself, and then if you just briefly tell about how do they recognize low or blood high sugar while fasting? Thank you.
Assalamu alaikum, everyone. I'm Dr. Sadiq Jeeyavudeen. I'm a consultant diabetes and endocrinologist, and I was working in NHS UK. Now I'm currently in Dubai attending this meeting. Regarding the question about how one should recognize high and low blood sugar, it is easy during Ramadan and during fasting to recognize low blood sugar compared to the high blood sugar. The low blood sugar symptoms are like sweating, trembling, palpitations, and then feeling extremely hungry, and in extreme cases, confusion and loss of consciousness. It is very, very important to note that if you had any hypoglycemia unawareness, meaning that if you hadn't had the symptoms of hypoglycemia in the past, you wouldn't have these symptoms to say that you're going into low blood sugar. So, to tell it in Tamil, இந்த மாதிரி symptoms உங்களுக்கு முன்னாடி வந்திருந்துச்சுன்னா sometimes your doctor would have labeled you as ஏதாவது partial hypoglycemic unawareness or a complete hypoglycemic unawareness. So if you have those conditions before, you wouldn't recognize any of the low blood sugar symptoms. But always counter check with either the capillary blood glucose or the finger prick readings, or if you have a CGM, check it on the CGM, because sometimes these symptoms overlap with during the fasting as well. So jumping from hypoglycemia to hyperglycemia. The hyperglycemia is slightly difficult to recognize in Ramadan because during the fasting you will have a symptoms of thirst, hunger, but one symptoms that would slightly be different is the excessive urination. If your blood sugar is high in your blood, it has to come out in the urine. It will overflow in the kidney, it will come out in the urine, and that point in time you'll have a frequent urination. But don't take that as only symptom saying that I don't have the frequent urination and I'm not hyperglycemic. So this is one of the symptoms. And in extreme cases, nausea, confusion. But if your glucose level goes into a state where your body is now producing acid, what we call it as a ketone acid, and some of you might have been testing this ketone acid, then you will start developing stomach acid, extreme nausea, and vomiting. So symptoms of hyperglycemia, again, extreme thirst, hunger, frequent urination, nausea and vomiting, and abdominal pain overlaps with the some of the symptoms during fasting, whereas the hypoglycemia, it's slightly different, like trembling, sweating, palpitations. But both the symptoms always counter check with the readings, either by the capillary blood glucose reading or by the CGM. The numbers to remember is same as you would have done for in non-fasting days. Like for hypoglycemia, less than 4 is considered as low blood sugar. And for hyperglycemia, different hospital uses different cutoff, but most safely it would be 14 and some would increase the threshold to 16, but it depends on your risk. So 14 would be safer, but up to 16 is okay. But beyond 16, it is time to break the fast.
Thank you. Thank you, Brother Jeeyavudeen. It's related to diabetes only. The next question is, because you said about checking the blood fasting, blood glucose, the next question is related to it. Can I check my blood sugar during the fast?
Yes, of course. Okay, it is allowed because it is a form of a medical treatment. Okay, so it is allowed to check your blood sugar because your blood sugar would dictate that whether you are going into low blood, as I was telling before, as most of the symptoms overlap with during fasting days. So, Kandipa, it is allowed to check your blood sugar during fasting, either by the finger prick or the CGM. So, there's no prohibition for that.
Can I just add, Dr. Ajumal, I think the Diabetes UK and the BIMA Ramadan Compendium advises to break your fast if your BM drops below 4.
Yes, that is correct. So the hypoglycemia, as I was saying, the blood sugar hyperglycemia cutoff, like some hospitals will leave it till 16, but if you would have like had a ketosis before or like gone into a ketoacidosis, even at 14 blood sugar, then accept a 14 blood sugar as your cutoff, high cutoff, and lower cutoff less than 4. If you have gone less than 4, you have to break the fast because there's only way of bringing your blood sugar is to take a glucose load, which is either oral the oral glucose load. So less than 4, kindly break the fast, and it is impossible to bring the blood sugar above 4 while during fasting when you go into hypoglycemia.
Sure. Before we go on to the chat questions, I just want to ask one more question related to diabetes. How should diabetes medication be adjusted for suhoor and iftar? Because the specific diabetes, how to be adjusted? Thank you.
So there are like different medication, and to add to the complexity, there are newer lot of medication has come. So taking for type 1 diabetes, so you will be on insulin. So most of the patient will be on basal bolus insulin, meaning a long-acting insulin and a quick-acting insulin. So the long-acting insulin is either a Lantus or Tresiba, which you would be taking once daily. So you will be taking that at night. So always titrate your long-acting insulin depending on when you wake up in the morning for the blood sugar. So if before fasting, when you wake up, the blood sugar you aim to be kept in the range between like around 6 to 10. So if it is lower, So it is advisable to cut your long-acting by 20%. So Lantus or a Tresiba dose by 20% during the fasting. And the quick-acting, which could be Humalog or Nova Rapid or Lumjo. So when you're taking these quick-acting blood sugar, most of the type 1 patient, they would be adjusting the dose by means of a carb counting. So you would be eating sahar for the sahar, whatever you're eating, you're carb counting your dosage, and you're going to skip your lunchtime dose, and your iftar, you're carb counting your Nova Rapid dose. If you're in the pump, it is advisable to change a different pump profile, adjusting your total daily dose and the pump infusion profile slightly lower, 10 to 20%. Again, it would depend on what was your previous control and what was your blood sugar. So that is with the type 1. Type 2 depends on how many medications you are. So if you're on metformin alone, and if you're taking once daily metformin, take the metformin at the iftar. If you're taking twice daily metformin, so take one metformin at Sohar and then one at the iftar. And again, if the blood sugars are day-to-day profile is on the higher side, you might need the dose adjusted as per your diabetes nurse specialist or a diabetes doctor's advice. Then comes the complicated medication. The second medication that is commonly used is either gliclazide or the glufosin. The gliclazide is the one that can cause low blood sugar symptoms. So if you're on once daily gliclazide, take it at iftar, not at sahar, because the gliclazide will reduce your blood sugar to a lower blood sugar value. So take it at iftar. But if you're on twice daily gliclazide, so the sahur dose of gliclazide, the morning dose, what you usually take it at a sahur at a half the dose. So not at the full dose, and the nighttime dose, take it with the iftar. The third group of medication called as the SGLT2 inhibitor. The medicines are the empagliflozin, canagliflozin, and the dapagliflozin medications. So usually these are like a very dehydrating type of medication, and also they can increase the risk for ketosis uh, when you're fasting. So if it is possible to, if you don't have any other comorbidities, if it is possible to come off the medication, you can come off. Or if it is not possible, take those medication at iftar, the empagliflozin, canagliflozin, and dapagliflozin at iftar and not at sahur. So when you're taking these kind of medication, the SGLT2 inhibitor at the iftar, these are increases the glucose level in the urine, and then it can cause urination. So you might have a symptoms of excess urination at night because you're changing the timing of the medication. And lastly, the GLP-1 medication. The currently now what we are using is the Mounjaro and Ozempic, and also the Ribelsus. So the Mounjaro and Ozempic are once weekly injections, and these are appetite suppressant. So if your blood sugar is very well controlled, some experts advise to come off these injections during Ramadan. But if you're on a very high dose of this, the higher dose of Mounjaro, which is 15 milligram, which like I would say the cutoff above, if you're 10 and above, so you can reduce these to at least half the dose. And also the Ozempic, the higher dose is 1 milligram. Again, cut it down to, if your control is very good, you can come off these and then see what is your blood sugar. But if your control is not very optimal, which is the HbA1c, if it is 65 and above, then cut it down to half, so that, okay, your appetite is there for you to eat at supper. And some type 2 diabetes patients, again on insulin, the insulin management is more or less similar to the type 1 MDI usage. So if you're the last one important point is about the mixed insulin. So if you're on the Humalog mix or on the mixed 30/70, so it is preferable to change that into a basal bolus insulin, because that will have a short acting and the intermediate acting. The intermediate acting can cause low blood sugar in the lunchtime. So that is one of the recommendations.
Thank you, Dr. Jeeyavudeen. You've been quite extensive. I mean, there's a lot. Even as a GP, I've learned quite a lot from your explanation. Of course, I will definitely pass it on to my colleagues. I think so. There is a question in the chat. I think we'll just raise it up before we go to the next questions. It is the first time after many years we are going to have fasting in a bit cold weather. Any specific medical advice for fasting in a cold weather? I mean, it is not necessarily you have to take brother Shafiq or Ejaz, you want to take it, or Usman, or cold weather. Do you want to give any specific advice?
I mean, nothing that I know of, like any specific medication that needed for adjustment of the cold weather. I mean, when I traveled from India to like UK, so in Scotland the weather was like in minus, so there was no specific medication adjustment was needed. Uh, so if you're like in the cold weather, have been on the same medications, so there is apart from the modification by your certain specialist, there is no specific medication that is needed for the cold weather, as per my knowledge. But I'm sure, okay, Brother Shafi or Brother Ejaz might add.
Have you got
Um,
anything to add, brother? Yeah.
I can add a few lines. I mean, I think excellent question, I have to say. I mean, because not just this year, but in the subsequent years, this question, answering this question is quite important. You know, the days will be shorter. So, couple of things. One, days shorter ஆகும்போது maybe ஜனவரியில் நோன்பு வரும்போதோ even initially in the வருஷம் people might tend to avoid suhoor, for example, so or they might limit their intake. So I think it's still quite important. எனக்கு metabolic activity rather than calories are important. So அது வந்து you need to bear in mind. So please don't skip suhoor. So you should have suhoor. Obviously we'll have something to eat, but make sure it's still a balanced diet. So don't completely neglect eating a balanced diet during suhoor, because metabolic activity during the daytime is important. அதே மாதிரி கோல்ட் வெதரில் வந்து சம்டைம்ஸ் நம்மளோட thirst ரெஸ்பான்ஸ் வந்து கொஞ்சம் சப்ரஸ் ஆகிடும். ஸோ அப்படி இருக்கும்போது இட்ஸ் வி ஸ்டில் லூஸ் வாட்டர் ஃப்ரம் ப்ரீதிங், ஃபார் எக்ஸாம்பிள், ஆர் ஸ்வெட்டிங் ஆர் யூரினேஷன். ஸோ அது மாதிரி இருக்கும்போது இட்ஸ் ஸ்டில் இம்பார்ட்டன்ட் டு ட்ரை அண்ட் மெயின்டைன் நம்மளோட ஹைட்ரேஷன். ஸோ அரௌண்ட் 1.5 to 2 liters. ஸோ அது வந்து அந்த மைண்டில் வச்சுக்கிட்டு டியூரிங் iftar to sohar, if they can divide up the fluid intake. So எல்லாமே ஒரே டயத்தில் குடிக்காம if they can divide on the 6 to 8 glasses between iftar to sohar, because நம்மளுக்கு தாகம் அடிக்கிறது அந்த அளவுக்கு தெரியாது during the colder months. So that's another important thing to observe, especially in the cold weather. So metabolic activity, and our body needs to generate the heat because it's cold. So not just the calorie control. So focus on the sohar, the metabolic activity. அதே மாதிரி avoid caffeine, for example, because then you lose a lot of water, and make sure you do drink your fluids, because நம்மளுக்கு thirst response அந்த அளவுக்கு இருக்காது cold weather அப்போ. So those two things are important.
Thank you, Brother Shafiq. I mean, it was an excellent explanation. I think so. Brother Habib is happy about the answer. Because you have started on with the Ramadan fasting and all that. Do you want to explain what exactly happens to our body, Brother Shafiq, during introduce yourself, and then you can discuss about the physiology of the fasting and what happens to the body. You want then at least the people be able to understand it a little bit better, isn't it?
Sure. நான் என்கிட்ட கொஞ்சம் ஸ்லைட்ஸ் இருக்கு, நான் அது வேணா ஷேர் பண்றேன்.
Sure, definitely.
Sorry. தெரியுதுங்களா?
Yes. Yeah.
Okay, good.
Okay.
So, number brief, I'll talk a little bit about on the physiology. So, நம்மளோட body வந்து it enters a fasting state around 8 hours after the last meal. So, நம்ம சோறு சாப்பிட்டதுக்கு அப்புறம் 8 hours அப்புறம் it will go into a fasting state. So, அந்த 8 ஹவர்ஸ்ல தான் நம்ம சாப்பிட்ட the foodலாம் gets absorbed into the body. So, அந்த 8 hours கேப்புக்கு அப்புறம் தான் it actually goes into actual fasting state. So normal state அப்போ நம்மளோட பாடியில இருக்கிற glucose is stored in the liver and the muscles. So which is where we actually get the main source of energy. So during a fast, this store of glucose is used up first to provide energy. So அதாவது நம்ம லிவரும் மசில்ல இருக்கிற குளுக்கோஸ் வந்து ஃபர்ஸ்ட் பாடி பேர்ன் ஆயிரும். அதுக்கப்புறம் தான் நெக்ஸ்ட் ஸ்டேஜ் அந்த 8 ஹவர்ஸ்க்கு அப்புறம் இட் ஸ்டார்ட்ஸ் டேக்கிங் எனர்ஜி தேவைப்படும். இட் burns the fat. So next stepல வந்து it starts using up the fat, which is the next source of energy in the body. So other mind vechikitaka, we can understand a few other things. So nutrition is quite important. So whatever we நம்மளோட இப்போ நான் ரமதான் பீரியட்ல வந்து நம்ம எந்த அளவுக்கு பேலன்ஸ் ஃபுட் சாப்பிடணும்னு நம்ம ஃபோக்கஸ் பண்ணுறோமோ the same principle applies during Ramadan as well. So balanced food and fluid intake is quite important. அதே மாதிரி கிட்னி ஸ்பெசிஃபிக்கலாக பார்த்தீங்கன்னா இட்ஸ் ஆக்சுவலி குவாய்ட் அன் இன்டெலிஜென்ட் ஆர்கன். ஸோ நம்மளுக்கு பாடியில் வந்து ஃப்ளூயிட்ஸ் இல்லைனாக்கா இட் ஆக்சுவலி நோஸ் பாடியில் வந்து அந்த அளவுக்கு ஃப்ளூயிட் இல்லை. ஸோ இட் கன்சர்வ்ஸ் தி அமௌண்ட் ஆஃப் ஃப்ளூயிட். ஸோ ஃபார் எக்ஸாம்பிள் நம்ம வந்து சோரில் கொஞ்சம் தண்ணி நிறைய குடிச்சாக்க வில் வேக் அப் டு பாஸ் யூரின். பட் டியூரிங் த ரெஸ்ட் ஆஃப் த டே நம்மளோட யூரின் அவுட்புட் மேபி கொஞ்சம் கம்மியானாலும் ஆகும். பிகாஸ் இட் அண்டர்ஸ்டாண்ட்ஸ் நம்ம வந்து தண்ணி வந்து அந்த அளவுக்கு குடிக்கல. ஸோ இட் நீட்ஸ் டு கன்சர்வ் த பாடிஸ் ஃப்ளூயிட். ஸோ இட் அண்டர்ஸ்டாண்ட்ஸ். சொன்ன மாதிரி டு ப்ரிவெண்ட் மசில் பிரேக் டவுன், ஏன்னா அந்த லிவரும் மசில், ஸோ நம்மளோட மசில் இஸ் குவாய்ட் இம்பார்ட்டன்ட். இல்லைனாக்கா ரொம்ப வீக் ஆகிடும் அட் தி எண்ட் ஆஃப் ரமதான். ஸோ டு ப்ரிவெண்ட் மசில் பிரேக் டவுன் இட்ஸ் இம்பார்ட்டன்ட் டு ஹேவ் அந்த ஹை எனர்ஜி ஃபுட் சச் அந்த கார்போஹைட்ரேட்ஸ். அதே மாதிரி முக்கியமாக காம்ப்ளெக்ஸ் கார்போஹைட்ரேட்ஸ். நான் நெக்ஸ்ட் ஸ்லைடில் அதை காமிக்கிறேன். ஸோ கார்போஹைட்ரேட்ஸ் அண்ட் சம் ஃபேட் நம்மளோட நியூட்ரிஷனில் சுகர் டயத்தில் இன்க்ளூட் பண்ணுறது இஸ் குவாய்ட் இம்பார்ட்டன்ட். So Namari, this is what a complex carbohydrate would look like. So, for example, oats, brown rice, sweet potatoes, whole wheat bread, quinoa, kidney beans. So, idala whole wheat pasta. So, idala good examples of complex carbohydrates. And a complex carbohydrates, it doesn't break down very quickly. So, நம்ம வந்து சாப்பிட்டோன்னே it lasts for a longer period of time நம்ம பாடியில். ஸோ கொஞ்சம் கொஞ்சமாக தான் it breaks down and releases the energy. ஸோ குவிக் கார்போஹைட்ரேட்ஸ் நம்ம நான் காம்ப்ளெக்ஸ் ஸோ ரொம்ப சீக்கிரமாக அது எனர்ஜி பிரேக் டவுன் ஆகிடும். ஸோ காம்ப்ளெக்ஸ் சாப்பிட்டிங்கன்னா மிக்ஸ் பண்ணிங்கன்னா ஸோ இட் பிரேக்ஸ் டவுன் வெரி ஸ்லோலி. ஸோ ரொம்ப நேரத்துக்கு வில் ஃபீல் தட் there is energy in the body. So which is why having some complex carbohydrates, particularly at suhoor time, is quite important, and the slow release of energy during the fasting hours. So அதே மாதிரி fiber rich food is also quite important, because fiber rich food is digested very slowly. So for example, potatoes with skin, இல்லைனா vegetables such as green beans, அதே மாதிரி almost all fruits including apricots, prunes, figs. So இதெல்லாம் good examples of fiber rich food. So complex carbohydrates, அதே மாதிரி fiber rich foods include பண்ணிங்கன்னா it'll release the energy quite slowly. And முன்னாடி மென்ஷன் பண்ண, ப்ளீஸ் டூ அவாய்ட் கெஃபைன், பிகாஸ் கெஃபைன் கான்டென்ட் அண்ட் ட்ரிங்க்ஸ், அதே மாதிரி டீயில் வந்து கெஃபைன் இஸ் லெஸ், பட் இட் ஸ்டில் ஹேஸ் அ ஸ்மால் அமௌண்ட் ஆஃப் கெஃபைன். காஃபி, அதே மாதிரி ஃபிஸி ட்ரிங்க்ஸ் வந்து ஐ வுட் சர்ட்லி அவாய்ட் ட்ரிங்கிங் டியூரிங் ரமதான். It makes us pass more urine and makes us feel more dehydrated as well. So அதே மாதிரி it give you the burping sensation and the indigestion kind of feeling. So it's probably best to avoid fizzy drinks. So நம்ம சுஹர்ல வந்து include slow digesting foods. Iftar அப்போ I would suggest breaking on the iftar time வந்து maybe have a date, soup, அது மாதிரி give a break or a 10-15 minutes maghrib தொழுதுட்டு you can come back and then have your iftar meal. So அதே டயத்துல வந்து try to mix in some olives, onions, because they all have water content in the food la. Cucumber, figs, dates, so grapes, so they all have good water content. So it's a good way of opening the fast during iftar. So schematic, next 2 slides. So just to give you an example, especially when the days are becoming shorter, we could maybe have suhoor title on you can have a cereal, you can have some brown toast, adhe mari juice, some jam. So your complex carbohydrates, you've got some jam, some sugar in that. So adhe mari milk, and there's a bit of fat, so cereal. So this is a good example. Another example on there, you can have scrambled eggs, toast, orange, fruit, milk, yogurt. So this makes it a very balanced diet during suhoor. What we would certainly want to avoid is this. So oil-rich food, especially at iftar time, is not such a good idea. அதுக்கு பதில் what we can do is instead of having deep fried food, you could try chickpeas. So in the chaat மாதிரி யோகர்ட்ல போட்டு சாப்பிடலாம். Samosas வந்து bake பண்ணுங்க instead of deep fry or air fryல இருந்துச்சுன்னா air fry பண்ணுங்க. அதே மாதிரி instead of having இந்த குலாப் ஜாமுன் ரசகுல்லா சாப்பிட்றது மேலே milk based, so either rice pudding இல்லை rasmalai. So those are good examples. Have chapatis instead of parathas with oil, or grill the meat. So deep fry avoid பண்ணிட்டு try shallow frying. So those are good examples. So just another slide which shows how much ஒரு பிளேட்ல வந்து எவ்வளோ இருக்கணும் அப்படின்னு சொல்லிட்டு. So try to fill them up with green vegetables, அதே மாதிரி some pasta, complex carbohydrates, a little bit of fat, and a little bit of beans and pulses. So we've already covered this. I think, yeah, to summarize, I think it's important to focus on having a balanced diet. So remember, on the muscle and liver and the muscle breakdown are to avoid pandadhikku, try to include some complex carbohydrates. Focus on the drinking fluids and the 1.5 to 2 liters, but between iftar and suhoor எல்லாமே ஒரே டயத்துல குடிக்காம try to space it out ஒரு 2 glasses. ஸோ அதே மாதிரி கோல்ட் வெதரில் வந்து அந்த அளவுக்கு தாகம் அடிக்காது. ஸோ அது மாதிரி ப்ளீஸ் ட்ரை டு ரிமெம்பர் நம்ம குடிக்கணும் அப்படின்னு சொல்லிட்டு. அதே மாதிரி வெளியில் போயிட்டு எக்ஸசைஸ் பண்ணாமல், பிகாஸ் இட்ஸ் கோல்ட் வெதர், பட் டோன்ட் ஃபர்கெட் எக்ஸசைஸ் இஸ் ஸ்டில் இம்பார்ட்டன்ட். ஸோ முடிஞ்சாக்க தராவிக்கு வந்து தராவிக்கு வந்து வாக்கிங்கில் போங்க. ஸோ தென் தட்ஸ் ஃபார்ம் ஆஃப் எக்ஸசைஸ். இல்லைனாக்கா இஃப்தார் முடிச்சுட்டு கிவ் அ கேப் போட்டுட்டு ட்ரை டு டூ சம் லைட் எக்ஸசைஸ் வீட்டுக்குள்ளேயே. ஸோ டோன்ட் ஃபர்கெட் எக்ஸசைஸ் இஸ் ஆல்சோ quite key and important நம்மளோட பாடி physiology. So I'll end there. Thank you.
Thank you, Doctor. Before you go, there's a question which come from the people. Who with kidney disease can fast safely and who should not?
சரிங்க. So it's not a straightforward question, but the easiest way to answer this is one thing to bear in mind is diabetes and hypertension இருக்கும்போது kidney disease இருக்கிறதுக்கு வாய்ப்பு இருக்கு. But kidney disease வந்து it goes in stages. So நம்ம தெரிஞ்ச மாதிரி stage 1, 2, 3, 4, 5 இருக்கு. அது வந்து நம்மளோட கிட்னி பெர்சன்டேஜை பொறுத்து இருக்கு. அந்த ஸ்டேஜ் 1, 5 வந்து யூஸ்வலி 5 வந்து டயாலிசிஸ்ன்னு சொல்லுவாங்க, ப்ரீ டயாலிசிஸ். ஸோ அது வந்து ரியலி என் ஸ்டேஜ் கிட்னி டிசீஸ். 4 வந்து அதுக்கு முன்னாடி. ஸோ அந்த பெர்சன்டேஜ் டேர்ம்ஸில் பார்த்தீங்கன்னா லெஸ் தென் 30% நம்ம கிட்னிஸ் வேலை செய்யுதுனாக்கா அது 4 and 5. So 1, 2 and 3 I think generally should be okay. அவங்களுக்கு வந்து எந்த பாதிப்பும் வராதுன்னு நினைக்கிறேன். ஸ்பெஷலி இந்த டேஸ் ஷார்ட்டராக இருக்கும்போது நாங்கள் வந்து முன்னாடி அந்த when we wrote those compendium, days வந்து were longer. So even the patients on the CKD stage 3, we said, they have to take some advice. எனக்கு 16-17 hours அவங்களுக்கு வந்து ஃபாஸ்ட் பண்ணாக்க ரிப்பீட்டட் ஃபாஸ்டிங், அதாவது ஒரு நாள் 2 நாள் ஃபாஸ்ட் பண்ண பரவாயில்ல, பட் 30 days ஃபாஸ்டிங் பண்ணும்போது இந்த கிட்னிஸில் வந்து எஃபெக்ட் ஆகிறதுக்கு உள்ள வாய்ப்பு இருக்குது. ஸோ அது மாதிரி இந்த ஸ்டேஜ் 3ல இருக்கும். பட் இப்போ வந்து பிகாஸ் த டேஸ் ஆர் ஷார்ட், ஈவன் 1, 2, 3 alhamdulillah, I think they should be able to fast without any problems. But 4 and 5 வந்து I would advise some caution. எனக்கு 4 வந்து less than 30% ஆயிடுது. பட் அது வந்து 30 to 15, அவங்க வந்து 16 இருக்கலாம், 17 இருக்கலாம், 18 இருக்கலாம், which is very close to 15. ஸோ அவங்க வந்து ஃபாஸ்டிங் ரிப்பீட்டடாக பண்ணாக்க கிட்னியோட பெர்சன்டேஜ் கொஞ்சம் கம்மியாகிறதுக்கு உள்ள வாய்ப்பு இருக்கு. ஏன்னாக்கா அது ஆப்வியஸ்லி இந்த டீஹைட்ரேஷன் ப்ளஸ் கிட்னியில் நம்ம போடுற ஸ்ட்ரெஸ் டியூரிங் த ஃபாஸ்டிங் ஹவர்ஸ். ஸோ அது டெய்லி ஃபாஸ்டிங் பண்ணும்போது தெர் இஸ் அ பாசிபிலிட்டி அந்த பெர்சன்டேஜ் வந்து கொஞ்சம் கம்மியாகிறதுக்கு. ஸோ 15 வந்து 12 ஆகலாம், இல்லை 10 ஆகலாம். ஸோ that's not such a good thing, ஏன்னா it might push people into dialysis. ஸோ அதே மாதிரி டயாலிசிஸில் இருக்கிற பேஷண்ட்ஸ் வந்து we generally recommend no, பட் அது தெரிஞ்ச மாதிரி when I was Middle Eastல இருக்கும்போது I've seen patients on dialysis fast. ஸோ அது மாதிரி இருக்கும்போது what I might suggest is last 10 days, மேபி அந்த லாஸ்ட் 10 days வந்து ரொம்ப அந்த ஹோலி பீரியட்ல வந்து மேபி அந்த டயத்தில் இல்லை ட்ரை டு ஃபாஸ்ட் மேபி டியூரிங் யுவர் நான் டயாலிசிஸ் டேஸ், ஏதாவது 1-2 இன்ஸ்டெட் ஆஃப் டூயிங் த ஹோல் 30 days. ஸோ மேபி பிக் 1 or 2 days. ஸோ டயாலிசிஸ் பேஷண்ட் ஜென்ரலி இன்னொரு ரீசன் அவாய்ட் பண்ணது எதுனாக்க நம்ம இஃப்தாரும் சுகரில் வந்து நிறைய பொட்டாசியம் ரிச் ஃபுட்டு சாப்பிட்ருவோம். ஸோ டேட்ஸில் வந்து நிறையா இருக்குது பொட்டாசியம், ஆப்ரிகாட்டில் நிறையா இருக்குது பொட்டாசியம், ஃபிக்ஸில் நிறையா இருக்குது. ஸோ நம்ம வந்து ஜென்ரலாக நம்ம கல்ச்சுரலி இஃப்தாரில் வந்து அது மாதிரி சாப்பிடும்போது அவங்க டயாலிசிஸ் போகலனாக்கா அந்த பொட்டாசியம் எல்லாம் பாடியில் அக்யூமுலேட் ஆகிடும் அண்ட் இட் கேன் பி குவைட் ஹார்ம்ஃபுல். ஸோ அந்த ரீசன்ஸ்க்கு வந்து இட்ஸ் குவைட் இம்பார்ட்டன்ட் த டயாலிசிஸ் பேஷண்ட்ஸ் டோன்ட், பட் இஃப் தே வாண்ட் டு then I would recommend that they speak to their dialysis clinician or doctor or GPO to put together ஒரு monitoring plan மாதிரி. எனக்கு அவங்களுக்கு வந்து பொட்டாசியம் ரொம்ப அடிக்கடி செக் பண்ணணும். ஸோ இல்லை டயாலிசிஸ் ஷெட்யூல் சேஞ்ச் பண்ணலாம். இன்னொரு விஷயம் வந்து சம் சென்டர்ஸ் வந்து யூகேலேயே வி ஹேவ் ஓவர் நைட் டயாலிசிஸ். ஸோ தே ஸ்டார்ட் அட் 6 or 7 o'clock, இல்லை தே ஸ்டார்ட் அட் 11 o'clock. ஸோ அது மாதிரி தே கேன் சேஞ்ச் த டயாலிசிஸ் செஷன் டு ஓவர் நைட். ஸோ அந்த ஆப்ஷன்ஸும் இருக்குது. ஸோ இன் கேஸ் டயாலிசிஸ் பேஷண்ட்ஸ் ஆர் keen, so please discuss with your clinician and the options la irukku for them to fast safely.
Thank you, Dr. Shafi. We have a cardiologist among our midst, and that's why there is a question for cardiology now. The first question is introduce yourself, Ejaz, and then is fasting safe if I have heart disease or heart failure?
Assalamu alaikum warahmatullahi wabarakatuh, everyone. Alhamdulillahi rabbil alamin wassalatu wassalamu ala rasulillah. Jazakallah khair to UKTM for giving me the opportunity and to contribute to the meeting. The question about fasting with heart conditions, again, முன்னாடி எல்லாரும் சொன்ன மாதிரி இந்த ரமதான் compendium that was published by BIMA actually gives quite a bit of detail in terms of when you can fast and when you cannot fast. Heart disease பொறுத்த வரைக்கும், fortunately, most of the conditions, as long as it's well controlled, you would be able to fast. So, for example, if somebody's had a heart attack in the past, okay, 2-3 years முன்னாடி heart attack வந்தது, stent வச்சாங்க, அதுக்கப்புறம் I've been fine, I just take some medications. It's important to keep taking the medication. So if you are someone who takes a medication, during the night, during the day, then you can change the timing of the medications. So fasting எல்லாமே some medications சுகருக்கு முன்னாடி இல்லை சில medications இஃப்தாருக்கு அப்புறம் அந்த டைமில் சாப்பிட்டு you can kind of manage. So heart attack வந்திருக்கு, been fine since, no problem, absolutely fine to fast normally. If somebody is, say, for example, got things like heart failure, so heart சில பேத்துக்கு வந்து ஹார்ட்டோட பம்பிங் ஃபங்க்ஷன் ரொம்ப வீக்காக இருக்கும். அதுலேயே நிறைய கேட்டகரிஸ் இருக்குது. Some people, when the heart pumping function is weak, but it's well managed, ஸோ அவங்க பாடி வந்து பாடியில் ஃப்ளூயிட்லாம் பில்டப் ஆகாமல் அந்த மாத்திரை வச்சு ரொம்ப ஸ்டேபிளாக மெயின்டைன் பண்ணிட்டு தேர் ஸ்டில் பி குவைட் ஆக்டிவ் இன் டர்ம்ஸ் ஆஃப் சிம்டம்ஸ். ஸோ நடந்தால் அவங்க மூச்சு திணறலாம் வராமல் அந்த மாதிரி ஆக்டிவாக இருக்கிற ஒரு குரூப் ஆஃப் பீப்புள் இருக்காங்க. தே மை பி ஏபிள் டு ஃபாஸ்ட். வெரஸ் there could be other people with heart failure where they have like fluid in the legs, because fasting, one of the main things that happens, as explained, is the fluid, because you don't take any fluid intake. So on the time during which you're not fasting, you continuously lose fluid without any intake. Normally body is able to cope with that kind of dehydration, but if your heart's pumping function is already very weak, then you may not be able to cope with that change in the fluid intake, and that, along with the medications you're taking, can sometimes make you more poorly when you fast. So if you have advanced heart failure, நடந்தா மூச்சு திணறல் வருது, அந்த மாதிரி situationல வந்து the general recommendation is not to fast. Those people are excused from fasting. As most of you know, if you have a valid health reason not to fast, then you are excused from fasting. So அந்த மாதிரி people, they are excused from fasting. But other things, சில பேத்துக்கு வந்து அந்த ஏஎஃப் அப்படின்ற ஒரு ஹார்ட் ரிதம் அப்நார்மாலிட்டி இருக்கும், ஏட்ரியல் ஃபிப்ரிலேஷன் அப்படின்னு சொல்லிட்டு, அந்த மாதிரியான சில கண்டிஷன்ஸ்லாம் இருந்ததுன்னா, as long as it's well controlled with the medications you're taking, you should be able to fast. So the summary answer is, most of the conditions, as long as they are well controlled, and as long as you have a way to make sure that the medications can be taken at the appropriate times, you should be able to fast. But there are some conditions where if it's not well controlled, like very poorly controlled hypertension, advanced heart failure, or some other kind of more rarer heart conditions that are not well controlled, you may not be able to fast. It's best to speak to your cardiologist. The BIMA compendium does provide a guideline in terms of risk stratification, so red, yellow, green type classifications on what is safe and what is not safe to fast. So you can have a look at it, and then you can, depending on what type of condition it is, you can either speak to your GP or your heart specialist for more specific tailored advice.
Thank you, Ejaz. I think so. In relation to for you only, there's a specific question has come up from in the chat regarding exercises or going to the gym while fasting. What do you advise for that? I mean, for general person as well as for people who are fasting. No pudikkaravungalukkum exercise gym போறது. What is your advice?
That actually is, it's a good if you're not if you're someone who doesn't go to gym, நான் ஜிம்முக்கு போக மாட்டேன், போகிறதில்ல, எக்ஸசைஸ்லாம் ரெகுலராக பண்ணுறது கிடையாது, ஸோ ரமதான் ஆரம்பிக்குது, let me try do something healthy good, then don't start doing something when you're fasting. If you're already someone who does exercise on a regular, now the daily on the gym I do the certain number of sets, I'll do cardio, I do running, whatever it is you're doing, you can continue. Most people, especially if if you're a healthy person, you can continue to do the exercises. There's no reason, especially in this year with the timings being a bit short, you should be able to continue to exercise. What you have to be more careful about is when you do the exercises, because obviously you will continue to lose fluid, and when you do exercises you'll get more dehydrated quickly. So general recommendation, there is a website, British Dietary Association, I believe. If you go look there, they do give quite a bit of advice on what kind of exercises you can do, when to do. In general, you can do all the exercises, whether it's cardio, whether it's isometric weightlifting type exercises, you should be able to do all of them as long as you've been doing them before. In terms of timing, it's best to do it, if possible, after iftar or just before iftar. You can also do exercise just before iftar, so you've done the exercise and then you're ready to break your fast. So even though you're very dehydrated, you're able to break the fasts straight away. And I think question also mentions things like walking and mild exercises. That's all absolutely fine, but don't take it up after Ramadan, and that's one of the reasons why we've had the seminar now, because we've got a month and a half before Ramadan, so probably not month and a half. So you can use that time to start doing some good habits. So it's a time to get ourselves closer to Allah subhanahu wa ta'ala, but at the same time it's a good opportunity that we have as Muslims to develop good habits, good healthy habits, whether it is to do with eating healthily, whether it's to do with picking up other habits like exercises. You can do that, but you have to start now rather than during Ramadan. So you do something now and then you can carry it on, inshallah.
Thank you. I think there was one more question there. It says what can be done to avoid extreme body heat during fasting in a diabetic person. Usually I think so, brother Shafi and Jeeyavudeen had already mentioned that most important is we have to drink adequate hydration. Thanni neriya kudikkanum between iftar and suhoor. And he's also mentioned to avoid caffeine and moderate salt intake, as well as we have to take your medicines correctly. Do you want anything more you want to add, brother Jeeyavudeen? I mean, he's mentioned about diabetes.
So the one point is about the urinary tract infection. So some tablets like the Jardians, like empagliflozin or DAPA, as I said, if the blood sugar is not controlled, it can cause a urinary thrush or a fungal infection. So very important for that point in time is to control the blood sugar by adjusting some of the other medication. If the urinary symptoms is so disabling, you can temporarily come off the SGLT2 inhibitors and then titrate the other medication to control your blood sugar. The milder symptoms, you can use some thrush creams that can be obtained from the local pharmacy itself. If you go to your chemist, you don't need a GP prescription to get the other thrush creams. If you speak to your pharmacist, chemist, they would be able to give you.
Sure, thank you. There was a question about pregnancy as well. Please may know during second trimester of pregnancy, what is the best way of manage fasting? Pregnancy is, I think we have to take it as a whole. Brother Dr. Usman, do you want to address about pregnancy, or do you want
Yeah, I can tell obviously if you're pregnant, you are exempt from fasting, so you fast பண்ண அவசியம் இல்லை. But we know that a lot of people who are pregnant fast. So the general advice from Ramadan Compendium and the advice is probably safer to fast in the second and third trimester rather than the first trimester. So that will be after 12 weeks. It's safer to fast compared to the first week. அப்புறம் வந்து if you have underlying health condition இருந்துச்சுன்னா கண்டிப்பா you will be classified into very high risk or high risk. So you have to consult your GP or your midwife or your gynecologist or obstetrician or specialist. Kandipa you have to consult before you embark on fasting. If you are healthy with no medical conditions, then you'll be possibly in the low risk or moderate risk, so you should be safe to fast. In the particular, the advice is second and third trimester, which is the after 12 weeks the safer fast பண்ணலாம்.
Sure, thank you. Something related to this, there's one more question come up. Can I take medicines to delay my period during Ramadan? Is it safe and permissible? I mean, normally we have traveling and we have a lot of medicines to postpone periods. Is it permissible? What does the ulama? Ejaz, you wanted to answer that question, Ejaz, because we run some fiqh and yeah.
So the majority opinion of scholars is that you're not, it's not advisable to take, contraceptive pills to delay your periods for fasting. So it's a part of, it's a natural process, and if it happens during Ramadan, then that is what you're meant to happen during Ramadan. So most of the ulama are of the opinion that you shouldn't be taking medications to delay your periods when for Ramadan. For Hajj, it's a bit of a different ruling, but for Ramadan, this is a general ruling, and that's what that is from the practice of the Sahabas. There's like hadith from Aisha radiallahu anha and stuff where we have this information. But obviously, it's a fiqh question, so you can, it's a very well talked about fiqh question that you can speak to your local ulama that you trust to get an advice depending on your own school of thought.
Thank you.
Also,
sure.
Sorry, add பண்ணிக்கிறேன் நானும். ஆமா, பட் ப்ராக்டிக்கலா பட் லாட் ஆஃப் உமன் pill இருக்கிறவங்க, so they want to fast. So if they are already taking any contraceptive pill, so the combined pill இருக்கு, அதாவது 3 weeks 1 week off pill எடுப்பாங்க. So அவங்க வந்து if there is no contraindication they continuously 2 months அந்த pill எடுத்துடலாம். So period வராது. So அது அந்த மாதிரி எடுத்தீங்கன்னா there will be one pill free break இருக்கும். So you can take the combined pill for 2 months continuously and then you will have your period, so that you don't get period during that time. Mini pill னு சொல்லுவாங்க. So if you're taking the mini pill, then you will have a breakthrough bleeding. அப்படி வந்துச்சுன்னா you can't fast. So அது வேற ஒன்றும் பண்ண முடியாது. But general, as you know, as Dr. Ejaz said, if you are menstruating, if you're having periods, then you're exempt from fasting.
Okay. And something related to this as well. Are medical procedures allowed while fasting, and when should the fast be broken? Medical procedures, anyone wants to take it up?
So, in terms of invalidating fasting, the basic principle behind there is a difference in opinion between the schools of thought in terms of what kind of activities would invalidate fasts. But the basic idea is they have something called a qualifying agent. So there is something that should be an item that should break the fast, and then you have the qualifying passage, so the route of entry, how it enters your body. So those are the kind of things that scholars talk about when it comes to determining when something breaks the fast or not. So, for example, air doesn't break fast, just because because you can't see it, on the mari. Whereas if it's a stone, even if it is not edible, if you end up swallowing a stone intentionally, then it will break a fast, for example. So on the mari, you have qualifying agents, qualifying passage, which is like taking things through the mouth. So taking things through the back passage. So if somebody takes medication through their back passage, that will also break a fast. And the madri, so qualifying passage, and then a qualifying agent, which is like sometimes tablets, sometimes fluids, IV fluids, and the mari. So those are the kind of things that scholars look into when it comes to what would break a fast. In terms of medical procedures, generally speaking, depends on what the procedure is. If it is a blood test, that is also a procedure. It doesn't break a fast. But if it is something, say, like, for example, an endoscopy or a colonoscopy, there's no doubt that will break the fast. So, yeah, if you're having that, then you can't fast. But again, this is where why that procedure is being done is also important. So if you're having an elective procedure that can be delayed for a month, then you can delay it and then have the procedure after Ramadan. Whereas if it's an emergency, they're looking for more serious condition, cancer, and it's something more emergency, that time critical, then obviously you are exempt from fasting, because it's a health ailment that they're trying to diagnose and treat. So you'll be exempt from fasting anyway. So you have the test at the time and you can catch up the fast later. So that's kind of the general advice when it comes to fasting. Obviously, dialysis, Shafi, Dr. Shafi Malik has already talked about before.
Yeah, just and thank you. I think that we had a wide discussion. I think we've got only 2 more minutes to go before we close the session. Is there anything specific you want to add, Brother Jeeyavudeen or Shafiq or Usman, before I close the session? Ejaz, anything is there?
Yeah, I think just, sorry, I'll let others go first.
So from my point of view, if you have a medical condition, if you are on medications, treatments, just there's still time. I know you're all struggling to get appointments, but you have time. So at least 4 or 5 weeks. So speak to your healthcare professional. That can be your practice nurse, your GP, your specialist, any nurses. So if you have a medical condition, make sure you discuss with them, get a plan, because they need to assess your individual risk, and then because you want to fast safely. So that is more important from my point of view. I just want to highlight that and emphasize that.
I think that one more question has come, Brother Shah. We can address it. How the 6 to 8 glasses of water to be taken at what frequency during the winter month, Ramadan? Or question on the
So it's a good question. So generally, I think during iftar I'll have 2 glasses. So Taraweeh pomada I'll normally take a bottle, but usually for a masjid they'll give us a bottle, so other half a liter bottle. So I'll have that. So about adli or 1 liter mudinjiruchu. So then the rest half is when you come back from Taraweeh you can have 1 or 2, and then at suhoor you would have 2. So adli easier 6 to 8. So there's no set frequency, but don't drink everything together. So அதுல என்ன ஆகும்னாக்கா நம்ம ஸ்டமக் ஃபுல் ஆயிடும், நம்ம சாப்பிட முடியாது, ப்ளோட்டிங் வரும். ஸோ அது மாதிரி பண்ணாம டிவைட் பண்ணுங்க, ஸ்பேஸ் பண்ணுங்க. ஸோ இஃப்தார் அப்போ 2 glasses, தராவி போகிறதுக்கு முன்னாடி 1 glass, தராவி அப்போ முடிஞ்சாக்கோ ஒரு பாட்டில் இல்லை 2 glasses, ஸோ வந்ததுக்கு அப்புறம் 1 glass, அதே மாதிரி சோரில் 2 glasses. ஸோ அதுலேயே ஒரு 6 to 8 glasses ஈஸியாக.
Thank you. Brother Jeeyavudeen, you want any last words before we close?
So it is very, very important. நீங்க கையில அந்த because of the low sugar symptoms எப்போ வரும்னு சொல்ல முடியாது. So checking machine like the glucometer, and if you're using sensor, very important to have it with you, and very important to carry some glucose, like either glucose tablet or glucogel, because when the symptoms happens you need to correct it as fast as possible. So அப்போ போய் தொலைவிட்டு இருக்கிறதுக்கு கண்டிப்பா கூடாது. Carry it wherever you go. The last point is the other endocrine condition, which is very important, is adrenal insufficiency. If anybody is on steroids, hydrocortisone, it's preferable to change to prednisolone, because hydrocortisone is twice or thrice daily medication. Prednisolone is once daily. So it's easy to take that medication in Sohar. So that is with on the steroid side.
What is the question?
Okay, Ejaz, you wanted to complete.
So I think the main thing I wanted to mention is, yes, we talked about all the conditions that you can fast with, but there will be a group of people who, despite all of this, will not be able to fast. They will be exempt from fasting. But what is important to remember is fasting is not just about not eating and drinking. Yes, that is a part of it, but there is a lot more to it. நம்மளுடைய ibadah, how we behave, our manners. There is this, we all know about this hadith from in Sahih Bukhari, where the Prophet ﷺ says, just transliterating, whoever does not give up forged speech and evil action, Allah subhanahu wa ta'ala is not in need of his leaving his food and drink. So if you're not going to change our behavior, if you're not going to change ourselves in terms of doing good things, refraining from sins, doing good actions, developing healthy habits, so that is the main that is key to having a successful Ramadan. So just because you can't fast, meaning you can't eat, you can't stop yourself from eating because of whatever reason, whatever health condition, doesn't mean that you will not be able to get the reward of Ramadan, because it's about all the other things which you can still do, regardless of whether you are fit enough to fast or not. And that's important to keep in mind. And yes, we will do the best in terms of giving you the ability to fast in the whole thing, eating, drinking, ellame. But ultimately, this is what Ramadan is about, and that's something that we have to keep in mind.
Thank you, Ejaz. Before we close, I think so the UKTM, they want active feedback. When I'm completing my closing remark, I would be grateful if all of you can fill up, if you go to the chat box, and it's very important to complete the feedback so that it will help us to give us better sessions or to see what is going on. As we come to the end of today's sessions, I would like to sincerely thank our esteemed panel of doctors for giving their time and expertise and practical guidance. I hope the key message we hope you take away is Islam prioritizes health, and where fasting may cause harm, seeking medical advice and making appropriate adjustments, including breaking the fast, is both medically and religiously correct. And we should also remember that everyone's situation is completely different. What is safe for one person may not be safe for the other. We strongly encourage, I think it was mentioned in the chat as well, we strongly encourage you to speak to your GP or specialist before Ramadan if you have ongoing medical conditions or take regular medications. On behalf of UK Tamil Muslims, I thank you for your continued engagement and trust. We pray that Allah grants you good health, wisdom in your decisions, and a safe and blessed Ramadan. Jazakallah khairan. Thank you. Jazakallah.
Also, please use the UKTM Ask the Expert questionnaire if you have any more questions. உங்களுக்கு questions இருந்துச்சுன்னா அது மூலமா நீங்க questions கேளுங்க.
Thank you.
Assalamu alaikum. Jazakallah.
Jazakallah, everyone. Jazakallah.